I'm Tonya Cross Hansel from the Tulane University School of Social Work.
This is Dr. Lorenzo Norris, Editor-in-Chief of MDedge Psychiatry. Today we're privileged to have with us Dr. Hansel, who is going to guide us in a discussion about the recent Capitol riots of January 6th. I want everyone to stay tuned because this discussion, we're going to really talk about some concepts and some themes that are critical that we need to think about as psychiatrists, as a society, as mental health professionals. So please stay tuned and listen to what Dr. Hansel and I talk about in regards to the Capitol riots of January 6th. Dr. Hansel, welcome to the Psychcast.
Thank you for having me.
Well, Dr. Hansel, when Gina and Jeff brought this across my desk in regards to talking about the January 6th Capitol riots, I said, absolutely. I really wanted to have a bit of a critical discussion about maybe some ways in which we can start to think about this. What are some of the ramifications and the after effects? And I'm glad that we have an expert such as yourself here to speak about this. For those of you who do not know, I am, longtime listeners will know, but I am based in Washington, D.C. And at George Washington University School of Medicine. So I was definitely present at, when this was going on in regards to the Capitol riots and the after effects that it had on the immediate DMV area. So we in the D.C. community do have a very personal up close view of this. So Dr. Hansel, with that being said, let's get into the first thing, because there are a lot of different views about, what the Capitol riots meant, even what people call it, and what group does this represent, if any. Dr. Hansel, when you think about the Capitol riots, all right, and will you keep using that term in terms, I'll just use other terms, but we're going to refer to Capitol riots. What do you think about in terms of the groups or the populations, and what does your work tell you about that when we think about those that were involved in the Capitol riots?
Well, it's not the majority of people and a lot of times media can have this influence where we look at something and it's so outside of our ordinary experience, that kind of almost a trauma trigger or a traumatic experience, especially for many that lived in the area that experienced it firsthand. And when we see these things, it brings about fear in us, and fear for the future of our country, fear for the future of children and people who will inherit this country. But I think the important thing is to know that it's not the majority of people, right? These are a small subset of extremists. And we have to keep that in mind, because otherwise it can seem so unsurmountable. And it can generate even more fear. So we need to really focus in on that. This isn't the majority of people. These are extremist groups. And we don't want to ignore this. This is something very important to look into and to figure out why and how and to really understand how we can prevent and recover from things like this in the future.
Right. Now, Dr. Hansel, this is such an important topic. I want to be very clear with those listening. I'm in no way, shape, or form an expert in this. I do not have a degree in sociology or social work, nor is this in any way, shape, or field, global mental health or terrorism or anything of that nature, my stock and trade. What I can say, though, is going back to what you said about subsets of populations. When I have looked at the Capitol riots, this is my own opinion, I do feel like there are different pockets. It seems like there were different groups there that did have different agendas. And I would dare say that we have video evidence, audio, video, and a number of things that support that, as well as, unfortunately, many individuals who lost their lives, both on the side of the rioters as well as on the side of our law enforcement agencies that were doing their job. But so when you say different populations, I can't speak for the listeners, but in terms of the eye test, I think if we allow ourselves to think about that, that does have that makes sense. Now, I won't get into like, breaking of the law or whatever, but there did feel as though there were different groups there trying to do different things. And some of those things were very, 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 well, I'm just going to say outright scary. Outright scary. Now, what would you label the most, if you would, of these different groups, what would you label to maybe the most extreme population if you had to?
Oh gosh, that's a difficult question, right? Because they're all extremists, right?
Oh,
They're all in some way disenfranchised, and that's usually the one word that we think of when
okay.
someone goes to those extreme levels, right? That they don't care about violence to the point that they
Okay.
need their message to be heard. Somehow they've become disenfranchised. And this seems like the only out. So in essence, there were many extremist groups, and this kind of event was a meeting of those. I think you're exactly right. There were so many subpopulations, so many groups of different disenfranchised people, which made this such a large, scary, and devastating event to the people that participated, and the people that were protecting our nation and the law-abiding citizens.
All right. So let's push a little bit. This is tough. This is tough. Now, of the folks that were there, because the term domestic terrorism has been used. Now, I may be thinking about this incorrectly. In my mind, I don't know if it's just because you were simply at the riot, you would be put into the domestic terrorism grouping. Was it a smaller portion of the rioters that people would conceptualize as domestic terrorists? These are questions that I have, and that I do not have a very good answer to in terms of how to think about it. How can you guide us through maybe just some ways, not necessarily give us conclusive answers, but some ways to think about these questions?
Well, let's break apart the definition of terrorist, right?
Right.
It's a person, it can be singular, and we can collectively talk about terrorists as a group and terrorist organizations, but their fundamental goal is to instill fear.
Mm-hmm.
And by that definition, that very basic definition of terrorism, I think anybody that went there with the intent of violence could be lumped into that category of domestic terrorism, that they are they want to invoke fear of people. And any way in that is what I would consider an act of domestic terrorism. And our responses to those types of acts are going to be very similar to whether it's, non-domestic or domestic terrorism.
Mm-hmm. Okay. Again, just kind of going back to that intent for violence. I think those are very important things, because I'm not sure, and I'm just talking right now. I'm not sure that I would characterize those that showed up at the January 6th, let's say, protest before it became a riot. All right. I have no way for myself of determining, for at least I would say the majority of the people there, whether there was an intent to violence, I would imagine for the majority, well, actually, I don't want to imagine. I would assume, I would say there's an intent to exercise one's right to protest. And I think at times there can certainly be a very thin line between intimidation, but we're not really talking about that. But I do think you raise a very important point. Those that came with the intent to violence. And I would dare say, I think that it has to be more than the thought. I would imagine that in terms of, to meet this definition, there has to be some form of pre-planning, tools available, some type of coordinated effort, because otherwise what I would get concerned is that we could start calling a lot of groups domestic terrorists, or people engaging in domestic terrorist activity. So I put that back to you for your thoughts in regards to that, because I want to make sure that we have at least a working framework in terms of when we think about the domestic terrorists.
Yeah, I think you're right on target. Like, it had to be some kind of premeditated. The goal was to get their point across through violence. And that was the number one goal. They went with guns. They went with a plan to, I think there's one thing to want your voice to be heard. And we see this all the time. And we wouldn't, even if it's not the voice that we want to hear, people shouldn't have their voices quiet. But I think at that moment, even in a riot experience, if somebody can't step back to say, this is going in a direction that I am not comfortable with, then I would, because many people did do that.
Mm-hmm.
They saw where it was going. And even if they aligned with those views, they left the scene.
Mm-hmm.
And it's those that took it that step further with violence and went in knowing beforehand that they were willing to risk their own personal safety in order to get their voice heard. That's where that critical distinction is, because that takes a whole nother level, like you said, of planning, of intent, and of just flat out disregard for the processes and procedures that we have in place to allow those voices to be heard.
Okay. All right. Now, Dr. Hansel, now that we've got some ideas, some working language around domestic terrorism, clearly we could spend, you and I could talk for the next 6 to 8 hours about this idea and this concept. With that being said, if one, from your research and your studies and your expertise in terms of what you know, what is the effect or what is the goal of specifically domestic terrorism, whether it's in the US or in other countries where we would say that there's certainly a bit more, one might think more experience or knowledge. I have to be careful about exceptionalism used in this country. All right. But what would we think is, how would we start to think about the effects that terrorism and domestic terrorism can have on a society or a group?
Wow, they're so great. I mean, that fear, that that fundamental piece of terrorism, that fear, can be so great for not only for the people that are enacting, or I'm sure there were plenty of people that were in some of these groups that I personally don't agree with, but that didn't like how that scenario played out. And I think there's fear in there. There's fear leading people to these types of incidents, and there's fear of people that don't agree with these kind of groups, and that can have a huge wear on that constant. We call it kind of chronic stress or chronic traumatic experiences, lived experiences, where every day you have a heightened sense of anxiety, and it's hard for us to bring that down to kind of a normal or functional level. And that can be very problematic for communities and for, our entire nation. I think, we've learned a lot. Fortunately, we don't have as many instances like this that are so clearly out of our norm. Large scale mass events where there's a threat to our government. But in other countries they do. And most people that have looked into kind of that thought, or that kind of what would cause someone to do this. And a lot of it isn't that disenfranchisement, and they're at their last straw and they resort to violence.
Okay.
So I think that's important. There's been some great studies about refugees from Somalia and how they, can get targeted towards some of these terrorist cells. And so we have a lot that we've learned from a very disenfranchised group, and belongingness, and how do we understand community and the importance of social connection, and how those can be buffers to having events like this.
All right, I want to come back to the community and social connection, but I want to go back to, and we're going to get back to this idea of fear, but I want to speak about this concept of disenfranchisement. All right, so Dr. Hansel, this is kind of the keep it real part of this Psychcast. I've spoken to my colleagues, people that I respect, a lot different folks. You're going to get different views of what actually happened. Like, and these are folks that, I go to bat for any of them, but we have gotten into some significant discussions about what has happened. And I'm in terms of just even the intent, no one disputes the actual visual evidence or the facts. But again, going in regards to the intent, the seriousness of it, how much it should produce concern or fear. And I got to tell you, that creates a great deal of tension or anxiety just to talk about it, because you'll be talking and you're looking at the same thing, and then your colleague or your friend or your partner or whomever, they're going to be looking at it and they're going to be coming to a very different set of conclusions. But part of me actually starts to think is, what can we agree upon, and what side are you viewing it from? Are you viewing it from the side of the folks that were attacked, or are you viewing it from the side of those that were disenfranchised, and you maybe thought there was or felt a reason that these type of things can occur? So just putting that to you in terms of any thoughts in regards to that, because let me get specific. What would cause people to, if you will, maybe look at these events in a different way, or actually, I would say it, minimize it? Because some people would not say that this was an attack on our government. Some people would. I mean, I'm just going to be blunt.
Well, I think a couple of things. One, we're not robots, and that's a good thing. And so we want different perspectives, and we want to be in a, and I think some of the best way that we're going to address some of these issues are to do exactly what you're doing and having these conversations, even though they're difficult conversations to have, but ones where we can say, well, which perspective are you looking at this from? And where we don't feel attacked as a person when we're looking at this and trying to be objective. And the second point is that, does it really matter? Right? If I call it domestic terrorism and somebody else says, "Oh, this was, a group, a violent extremist group," or it was a way to get heard or something like that. The important thing is that after effect, that it did happen.
Okay.
Luckily, we have evidence, so there's no doubt in that. But it did happen. How do we move on from this? How do we really work toward avoiding this and being connected in community, and being able to have conversations where, if we both disagree on something, we can have a conversation that would help enlighten both of us to why someone might feel this way and why someone else might feel this way. And not that you're trying to change your opinion in any way, shape, or form, but that you may have a better understanding of that person. And I think that's where we need to be currently as a society. These things did happen. I don't think anyone would say that they aren't terrible on any side, that this was a terrible event. People lost their lives and were injured, seriously injured. So I think the important thing is to say, how can we prevent these things happening? How can we make sure people still have a voice, even if it's not the voice we want to hear? And, and then how can we, decrease that chronic fear that people have when we also see in headlines, planned attack in the future? And how do we not live in a fear society? I think is going to be very important for recovery.
You know what, Dr. Hansel, as you said that, I was really glad what you said in regards to the language that you used. Many of those I've talked about, actually, I'll speak for myself. My experience of the Capitol riots was absolutely, I still remember watching it with actually a surreal thought. Like, at first I was looking at it, I was like, oh, okay, this is here. And I'm like, wait a minute, hold it. People are inside the Capitol. And then you saw the images. I'm like, wait a minute, what? And I immediately was, where is, the military, the National Guard? Where are all these elements to potentially stop this? And I will absolutely say for myself, there was an element of significant fear that this could go unchecked. I just thought it like startling, not saying one thing or another. I'm sharing with people my own personal view in regards to the fear that I felt, because it did not appear to be stopping. So whenever people start to relive that event, I can speak for myself. There's the first initial part of it. You're like, oh, wow, they're there, they're this, they're outside. And then after a while, once you get into hour 1 or 2, you're like, wait a minute, this has got to stop. People are seriously getting hurt. And this is, in terms of that fear, this is our capital. This is this. If you're thinking that this is supposed to be one of the most protected places, in the country, if not on the planet, and this can occur, then that's going to get at this idea of fear. But what I'm getting at is what you said in regards to, yeah, it does matter what we call it, but it doesn't matter what we call it. And look, I know, I get it. People listening to me, I'm gonna get some pushback, but listen, sometimes we got to take so that we can engage in a dialogue. And that's why I said, if we can, okay, you call it this, I call it that, we're going to have to, but if that's going to allow us to get past the fear, because the fear is designed to what? To split us. And then we can get to the after effects. That's where I do believe that we can actually have some common ground. All right. So Dr. Hansel, with this, we know about the terrorism and the fear and the splitting, or that's kind of where we're going with it. How does society respond to this? What do we do? How do we overcome or grow?
Well, I did a study following the World Trade Center attacks and kind of looking at how we process the fear of terrorism and these kind of outrageous things happening on a potentially regular basis, and and does this our new normal, or is it our new normal? I think is a huge kind of indicator. Proximity matters. Like you said, this was just this was in your neighborhood, this is, in what you view community. And that's going to make, so people that are in and around the Capitol are probably going to have a stronger response. And we need more mental health services. I don't have to tell you that there aren't enough providers. There's still a stigma. We must, and this is for whatever side you're on, we need more mental health services, so we can potentially intervene before violence happens. I mean, that's a huge part of people feeling disenfranchised, and having someone that they could talk with, or addressing mental health problems early on. And when things like this happen, having community around well-being and improving one's outlook and being able to process these very traumatic things that happen. And I think an important thing is that this occurred in the middle of a pandemic.
Yes.
It occurred at a height of when almost every state was having huge surges. So when our stress levels are up here, and we exacerbate that with now political instability, civil unrest, those types of things really take a toll on individuals that may not have had much left to give, because we've been dealing with a pandemic, and we've been dealing with other incidents of civil unrest and problems. And so there's just, I think that exacerbation piece is something that I think we need to focus on, that this isn't just a one-time event. This is accumulation of people's lived experiences. It's an accumulation of lived traumas of all kinds of things, not only just in the past year, but a history of it. And we need to have better programs and more availability of even just kind of larger scale of acceptance of mental health. And we did find that after Hurricane Katrina,
right?
That more people were willing to. They assumed everybody was going to be stressed. Of course, you're having a hard time. You just went through a horrific experience. Mm-hmm. And that was a motivator for some people to seek the mental health services that they need.
Dr. Hansel, this disenfranchisement piece is big. And I'm glad that you started to talk about the effect of COVID and disasters, because depending on how one conceptualizes, and there are many models, and I know that you've worked on models before in regards to disaster response. One of the biggest things I became concerned about in regards to COVID was that on traditional disaster responses, like at that year mark when you're at the disillusionment phase, and then you can start the recovery. All right, that's, again, it's an artificial barrier or marker, but it's a useful one, because I've actually seen that people do this. This was my biggest concern, was that COVID, we were going to get a third and a fourth wave, and it wasn't going to stop. So when people were trying to catch their breath, which is what you were getting at, They didn't have a chance to catch their breath. And I will continue to say this. The biggest thing that COVID does is it breaks our relationships and it reveals flaws that already existed. I've said it on multiple sitecasts. I'll continue to say it because that's what I see. So I think you were absolutely on with the disenfranchised. And this would be the other thing. There are many disenfranchised people of every race, ethnicity, socially that you want to name. All right. I would say that when disenfranchised, with those that are disenfranchised, the term I would say have been too strong for too long and they've lost their breath, then I think that this also can serve as, you said, exacerbating. I would also say potentially precipitating. And so again, I put it back to you in terms of your thoughts in regards to that and your experience with Katrina and like this perfect storm of events.
Yeah, and that's exactly right. It's a perfect storm of events to have kind of mass social problems. And, especially whenever you put the economic component in there,
Mm-hmm.
right? Because economics is power. And we know that for close relationships, technological disasters don't necessarily, unless there's an economical component, don't have as much disruption on family and friend and community units. But large scale natural disasters that tend to have a larger economic component for a larger community do. And this, whenever you see divorce rates shoot up, and that's when you see, some of these kind of social indicators that things aren't going right. And I think that's true for everyone. It's hard not to be disenfranchised at a time when you don't know what the next day is going to look like. And for many people, we've been doing this for a year. Like maybe we can say, oh, it's our new normal, but not really, because maybe not.
Maybe because I know it. The new normal keeps changing, like, every month. Does everybody remember at the start of the pandemic? I mean, you were hard pressed to find a mask. I mean, we were making masks. And then
people were doing the whole
exactly. We were putting our turtlenecks up. We were doing all types of stuff. I mean, we were just understanding how the virus was transmitted. And then, and let's be honest, the science has evolved. All right. Where before, it's fine. Or, oh, well, actually you need to be concerned about aerosol. And now you need to wear, but then wait. And, so all of this, as I would tell students or residents or folks in COVID time, a month might as well be a year. Like, last month? Oh, well, last month things were open a little bit, but now it's completely shut down. We're on lockdown in this region. So, if you have to keep going through that roller coaster in the sense of that keeps on going, is still depleting. Even though you're going up and down, your energy is still being depleted. And something that I thought about, have you had a chance to get your vaccine shot? I don't know.
No, I haven't yet.
The interesting thing I'm a healthcare professional, so I have, but here's the thing about it. Even with the shot, both doses, not that much has really changed in day to day. You still have to take many of the same precautions because you got to be concerned about your fellow citizen, your fellow man, or your family. As longtime listeners of the Sitecast know, I have children at home. So I still have to take many of the same precautions that, if not all of them, that I did before. So we've got definitely a long road ahead. But Dr. Hansel, let me ask you this question. Where were you at in 9/11?
I was in the Gambia, West Africa, in a predominantly Islamic community.
Wow. Okay. But I got to go. What were you doing there?
I was in the Peace Corps. I was in the U.S. Peace Corps.
You were in the Peace Corps.
Yes.
Oh, what led you to go to the Peace Corps?
Oh, I wanted to know. I grew up, in the U.S. in for most of the world standards, a very privileged existence. I had running water when I needed it. I had electricity, and as a social worker, I really wanted to know. I wanted to experience what it was like to not have those things, and to take those things for granted. And because I thought I would be able to serve my clients better. And it was true. I was able to give me a whole new perspective. But 9/11 for me is a very interesting experience because I wasn't here and I got everything maybe a day or 2 days late. And it was a predominantly Muslim community, but the support and, outpouring of, I'm so sorry this happened to your people, this over and over, what can we do to help your people? from the Gambians that I was close with.
Yeah.
It was just amazing. So I had a very different experience from, I think, what the lived reality was here in the States at the time.
That's interesting that you talked about the support that you felt in Gambia. At that time, for those of you listening to the Sitecast, today is March 19th, which is actually Medical Student Match Day. All right, where medical students find out where they match. I still remember finding out, that I was going to match in New York City at Mount Sinai Hospital, my alma mater residency, New York. And I still remember starting my residency internship. And then there was a code that I was new to the hospital. I didn't know anything. There was a code that flashed, that around. And I was like, what does that mean? What did that say? They said terror attack. That was my intern year, was 9/11 in New York.
Wow.
Yeah, my intern year was 9/11 in New York. So I still remember the leadership that Dr. Ken Davis gave our department. And I still remember walking back from the Upper East Side, which is where Mount Sinai is, it borders Upper East Side in Harlem, and walking down. And then after you hit about 60th or 50th Street, I mean, there had to have been people outside, but I don't remember anything because it was like the Twilight Zone. The streets were completely empty. All right. And then once I got closer down to, if you will, in the 20s or NYU, then I started to see the ambulance, the smoke, because I had to walk. So going back to what you said, the experience of shared resilience and community was very different compared to what I'm experiencing now. Even I'd have friends that felt like, are you all right? Are you this? Are you that? And I'm like, yeah. Whereas, to be perfectly blunt, with the Capitol riots and everything, I had folks, we have, friends or colleagues in different countries like, what the heck are y'all doing? What's going on? There was not this sense of support. There was a sense of like,
what'd you do?
Yeah, what did you do? I like, there's this sense of like, what are you doing and why aren't you stopping this? It was, whereas it went from support, it went to almost outright like questioning and some other stuff. So I just find that those two experiences are different, and you're kind of touching upon that, and even how we respond to a localized disaster such as Katrina versus a worldwide pandemic such as COVID. But you have a very interesting journey in terms of studying all of this, because Peace Corps, all right, wanting to actually understand things for your client. We've been talking about a lot of things. How did you actually end up studying or focusing on, if you will, disasters and knowing a bit about terrorism? Can you just tell us a little bit about how you came to that?
Well, I was on a research project in West Africa looking at HIV and AIDS rates.
Okay.
And I began to view that as a biological disaster. And so, how do communities come back from that? And then later, after I'd finished my service, I was traveling around and was up in Bali, Indonesia at the time of the nightclub bombings.
Okay.
And I was able to see how communities can come together when these horrendous things happen. And it was organic. It was people. It was human at its very essence of coming together, and people that did not know me and were looking out for me, residents of Bali, trying to see if they could help. And I think that's what I love about disaster research, is that human experience is true in every kind of disaster or terrorist incident, that people become their, perhaps it's most vulnerable, but also their human instinct takes over to support. And I think the hard part about the Capitol riots is that we're still in a pandemic. So that slow burn of stress, that slow burn of chronic anxiety, we're not at a point where we can build community yet.
Okay, we're not slow burn of stress. We're still in a pandemic. We're not at a point where we can build community. But okay, I like what you're saying. So I got to push you. But we got to, right? We got to do it. We have to.
We have to.
Right? I mean, so we can't accept that. May Dr. Carl Bell rest in peace. Who he would tell me I have to ask this question. You went to the Peace Corps, so that you can learn about this. So I got to push you a bit. All right. I know we're in a pandemic, but we have to do something because we cannot let this fear of social and political instability, as well as what new variants of pandemic might hold, stop us. Give us two things, if just two things that you know, like if you had to just bet on, all right, that are going to help. I'm not going to push you to like solve it. That'll be for the next Psychcast, but that's for the next one. The next Psychcast, I'm going to push you to solve it. But this one, I just need two things that are going to help us put a dent in, because we got a passionate audience out here. It's interdisciplinary. And they got lawyers, social workers, nurses, psychiatrists. We got everybody. So give us two.
Two things.
Just two.
God, the pressure. You're putting the pressure on me,
I'm
Dr. Norris.
putting the pressure on you.
Two things. Well, I think one, science, right? Yay, science.
Yay, science. Okay.
Yay, science. I mean, science has really helped us. You said, things are changing. Some people don't like that. Some people don't like that science is slow. They want the answers right then. And that can lead to some of that disenfranchisement. I think probably most of the people listening to your podcast appreciate science and understand how important it can be. Science also tells us that we will persevere through this, that there is no doubt in my mind that we will be able to come back and be stronger and hopefully better.
Yes.
And I think this starts with having conversations, small ones that may seem insignificant. Calling people out on not mask wearing. I know in my family, it was pretty funny because many of them are from Texas, notorious for not wanting to wear a mask. And I'm in Louisiana, and in New Orleans specific, where we had a huge spike early on, and community rallied. And I mean, everybody was holding non-mask wearers accountable, saying, look, we got to figure out what's going on. Okay. And I think those types of things of being able to find common ground, even if somebody says, well, it's my right to not wear a mask, and I say it's my right to wear a mask, and having that sense of we can coexist with different opinions, and we can have conversations about tragic things that may have different, you can have a different opinion on why they exist or how they exist. But the most important thing is that coming together around everyone wants this to be a better world. And everything we're doing, everyone's given up in the past year, and everyone has had to sacrifice something, is building that community. And I think that is truly what's going to get it. Right now, we're still in that preservation mode. We're still trying to get through the day to the day. We see some hope, and I'm very, very optimistic that it's going to continue. But we have to kind of just continue in that survival perseverance mode. And then, when things start to look better, they're starting to look better. As that continues, we'll be able to do some of this community work and say that we did it. We survived this, and we can be stronger because of it.
So Dr. Hansel, I asked you for two things, and you know what? You gave me four. So, and I knew you were going to do that. So, but the things that you gave me are so very important. And this is kind of what I take from it. The science. When I think about the science, I think about one, did we even think that we were going to have vaccines at this point in time? No, but we do. If we really start to appropriately look at the science, get vaccinated, do appropriate precautions, and hopefully we start to build herd immunity, we are going to be able to move forward with this. The next thing that you said was huge. Small conversations. Don't necessarily try to engage in this huge, big thing, but just, and hopefully Dr. Hansel and I demonstrated this a bit. Break it down into something digestible. Take a big thing and break it down into something that you can actually begin to talk about or address. All right. So small conversations, because when you're doing that, it's got to be facilitating that sense of connection. The other thing, which I think is hugely powerful, acknowledge the shared loss. Acknowledge the shared loss. And you said it, but we all lost something. Do not think that you were the only person that lost something in COVID. everybody, it is a global, in the truest sense of the word, global life-altering event. And we have all lost something. And when you said that, what I thought about was your experience in the Peace Corps. And when the folks that you were with, they turned to you and they said, wow, what can we do to support you? I think if we can just take a little bit of what you learned from that group, that population, that tribe, and apply it to each other on a daily basis where we don't burn out, we're going to start to demonstrate some resilience. But y'all, we got to fight for it, y'all. We got to dig in. I know everybody's tired and out of breath. We got to fight for it. So particularly, this goes out a shout out to all of the physicians that are coming out, on match day. Y'all know what you got to do, and you got to do it in an interdisciplinary fashion with your colleagues in social work, nursing, psychology, hospital administration, you name it, everybody. It's a team effort. But Dr. Hansel she's given us some things to start to think about in terms of how we navigate the pandemic, the social unrest, and how we start to think about in terms of getting that connectivity that's going to get us through this. Dr. Hansel, last words are yours. What do you want to leave us with?
Now that we are getting back to some glimpse of what normality is going to be like, as mental health professionals, we know that that's when our work really starts to begin. And I think we need to come together in solidarity to, and I loved what you said about, it's the psychologists, social workers, psychiatrists, all working together to really highlight the needs that we're going to have in mental health and how we can get through this with resilient outcomes versus pathological ones.
Dr. Hansel, I want to thank you for appearing on the Psychcast with us today. I actually really am hoping to have you back. You don't pull any punches, and that's what we like on the Psychcast. So it has been a pleasure, and you be safe and you be well. And big shout out to everybody in Tulane and in Louisiana and all of our people down in the South, especially those in Texas. And as I'm recording the Psychcast, sincere, heartfelt condolences for all of those in the state of Georgia, in this country, in the world, after the horrific losses that we had in the recent events in regards to the unfortunate deaths in Georgia. So with that being said, thank you all for listening.